so it won't be live. So I'm not gonna ruin anybody's homes saying, oh, I'll get on at 5:30 to see Josh. I'm gonna switch the order.
Right.
All right? And, is Adam Traub here yet? Is he behind?
No, he's not here.
Okay. And then Rick, is Katrina here?
Not yet.
Okay. What do we got? We got about 6 minutes. Hey, Rick. Just trying to think, is this Katrina right here?
Yes.
Hey, all right.
Katrina?
I did pull.
There's that, okay. So, this is great, big crowd, department heads. Love to get those nameplates. That's awesome. So, method to my madness of why we're gonna just switch the order. The middle one will still be Rick and Katrina, and Josh will go last. Sorry, guys. I know you. But Chris and Adam, there he is, kind of late notice that I asked them to come in to help with this 6:15 item, the update on the town facility masking. And so I'd like to have that go first, so you guys, especially, I think there's some scheduling things.
Oh.
But you know what?
Thank you.
My lack of preparation shouldn't be a crisis on your person.
Thanks, Tom.
And actually, to tell you the truth, I really think this should be a 10-minute thing. Tops. But maybe not. We'll see.
Okay, Chris, are you presenting? Okay, then I'll get Katrina. Okay, we're good.
Tom, you want us to go up here? Can you do this here?
What is it, 5? What is it? The fact of the matter is that with this update on the town facility masking and vaccination of employees and visitors in the facilities, it all spawns off the governor's not extending it past February 10th. So we're about 2 weeks into this. But I'm going to present something in 2 minutes when it starts and we get on tape. And I really think, Dolly, you're a great representative of town hall because we have a lot of visitors, citizens come into town hall. And the other 2 facilities in town where visitors come into the most, let's call it what it is the rec center, which Chris is your purview, and the library, which is Adam's. So as we have this conversation, I think it's fair that the 3 department heads who kind of oversee the most visitor-laden facilities, I wouldn't want the board to be making decisions without hearing at least your guys' 2 cents on this. All right? We're going to do the exact opposite order, going with the middle one will still be Rick and Katrina. No, and like I said, I got some intel after we spoke today. And like I said, Chris and Adam on late notice were gracious enough to come in. So, and I really, like I said, I don't think just don't think this update of the town facility masking vaccination for employees and visitors to facilities agenda item will be more than 10 minutes. I'd be very surprised. But we'll see. And then we'll roll right into Rick, Katrina, and then Josh, and Nick, and Kyle, and Kareem. But you get to see the whole thing today.
I do. I just stayed in.
We won't, I think it'll still be light out.
Did we take a bet on that, by the way? I'm saying, right, I'll take the bet, double down, it's gonna be dark.
Can I pay my steak lunch off to you first before I bet you again?
Well,
All right?
it'll be a long time, because it's It's been 6 months.
Here. We don't get started.
You're not
Well,
gonna
it's
make it.
5:28, and for the record, Jack, the last two formal board meetings, 17 minutes and 22 minutes.
Okay. Dark or light?
It's 5:29. Karen, since we're not live, whenever you want to
Go ahead.
start the taping. Okay. So, all right, so I think nobody else has come in the room since I gave the prelude, preface, whatever. We will start, we have 3 agenda items tonight for the workshop. We aren't live, hopefully, knock on wood, we will be within the next week as we take care of our leaking ceiling here and not have our audio and visual equipment at risk. We're going to do a reverse order tonight. The 6:15 agenda item, the update on the town facility masking and vaccination of employees and visitors to the facility. We're going to do that first. There is no per se presentation on this. Brayton Connor, who is our Human Resources Director in town, is on vacation this week. And I promised him I think I can do a yeoman job in replacement of him of the issue, if you want to call it, at hand. And it's really simple. On February 10th, Governor Hochul here in New York State made the decision not to extend the mask policy, policy of either you check vaccination of all employees and visitors, or if you're not willing to do that and mandate vaccination of all employees and visitors, then it's mandatory masking for all employees and visitors. That was in place from December 10th until February 10th, for 2 months. Now, prior to December 10th, the health department or the state governor, executive orders, whatever, it's been moving target all along. The town was taking the guidance that our policy prior to December 10th was, very simply, if you're fully vaccinated, you don't need to mask as a visitor or employee. If you're not fully vaccinated, you need to mask. But we are not going to be checking vaccination status at the door for visitors and employees. That was our policy. It really came from and spawned off the state, the Department of Health, the county, whatever. After the governor changed that on December 10th to what I previously described, when she did not extend it past February 10th, we assumed, and we all know what happens when you assume, that it was, we go back to the prior December 10th. That's what we did. So right now, for the last 2 weeks, the town facilities have been operating under what I just described of mask if you're not vaccinated, don't mask if you're fully vaccinated, but we're not checking. Brayton informed me after, and Brayton is quite the researcher, as we know, that once he did some more research, he found that really, after February 10th, there is no more health department, state opining on this. Long story short, and I'm only 2 minutes into this, the way I see this is that the way we are currently operating the last 2 weeks is tantamount to the town having its own policy for how we handle our facilities. And if that's what we want to do going forward, and my friend Charlie is not here today, I would suggest we probably do some board resolution at the special meeting on Monday, the 28th, or at next Thursday's meeting, the 3rd, and non-pro-tunc, if you want to call it that. That going back to February 10th, this is our policy. That's one thing we can do. The other thing we can do is that I think that consistently over the last 2 years, the town board, at least the last 2 years, has not really gone out of their way to make their own laws on this. We have followed state and health department laws. Now, if we want, and we want to continue with that, then we could very easily just say, tomorrow, take down the signs, and there is just, you can come into town hall, you can work at town hall, and it's just your option of whether you want to wear a mask, and vaccination or non-vaccination is, it doesn't matter.
Well, in my opinion, that's the way to go, because, you know, I've been,
Wow.
I've been quite
You know what?
outspoken about this.
John,
This mandate is completely unconstitutional. It's going to be tested in court.
we just did.
Almost every, I think there's only 2 or 3 states that are even still utilizing this mask mandate. The science is out there, and you know, I will not be in favor of any policy that requires masking. I think it should be up to each individual. If you're comfortable wearing a mask, by all means, wear your mask. And the
Okay.
biggest travesty, in my opinion, is that while our governor did not extend the mandate for businesses and municipalities, she's still requiring our children to be masked. And that, in my opinion, is a travesty.
Now, and thank you, John, and I will say this, we did open it up, I guess. What I was gonna suggest was that, based on what I just laid out, and now I'll say what John just laid out, because Adam Traub is the director of the library, Chris Bilo is here as the Parks and Rec Commissioner, and my good friend Ally Wire, who's our town clerk tax receiver, they are representative department heads of the 3 most trafficked facilities in town. And I just think as the board is deciding, if you want to call that, which way do we want to go, it might be interesting to hear your insights of what are you seeing the last couple of weeks and whatever at your facilities that might influence how we want to go about this in the town, so. Adam Traub, our new library director.
Hi, everyone. I'm Adam Traub, I'm the new library director. Thanks, Tom, for having me in for juggling the schedule. In the library, I've been there since January 3rd. Right about now, we are seeing about 10,000 patrons a month. In 2019 levels, we were about double that. We were seeing about 20,000 patrons a month. That's pretty consistent across Monroe County. For those of you who know me, I used to be the Associate Director of the Monroe County Library System, which supports all the public libraries in the county. As of yesterday, we're at about 71% of what we would see on a normal Wednesday. So the reason I'm kind of saying that is to set the context of the volume of patrons we see. So we're at 71% of what we saw on the Wednesday of February break in 2019, which is, you know, in my opinion, really good sign. We're on an upward trajectory. We're getting back to normal numbers. Since the mandate has been dropped, we're seeing about a 60-40 split of people wearing masks or not wearing masks. It's a mix of seniors and adults and children. We're seeing a lot of seniors right now because we have the AARP volunteering to do tax prep. So we've got a lot of people who are, you know, choosing to wear masks. You know, we're not checking vaccination status, of course, anything like that. But basically, we're seeing you know, it's almost 50-50, but not quite, kind of 60-40 in favor of people wearing masks right now. And the staff right now, I have asked to wear masks because those people who feel comfortable without them can come in. You know, they don't care if I'm wearing a mask or not, right? But those people who are wearing a mask feel a little bit more comfortable. And ultimately, libraries are spaces for everybody. That's true for people who are vaccinated, people who are unvaccinated, somebody who wants to wear a mask or doesn't want to wear a mask. We are for everybody. And so, as a result, to make that safe space, for now, the staff is wearing the mask. But, you know, we haven't had any issues since the mandate's been dropped. And, you know, people seem pretty happy. I mean, like I said, we're at 71% of our normal visitors, so we're seeing that uptick.
So let me ask you a quick question, if you don't mind.
Yeah, not at all.
What would your actions be if one of your staff decided they did not want to wear a mask?
So I have 2 staff who don't want to wear a mask, and they actually came and talked to me this morning. You know, we talked it out. They asked what my metrics were. They said, hey, we're going to do whatever we want. And honestly, when the town first relaxed it, you know, when the state did, you know, I sent an email and I said, respect everybody's choices. And they decided not to wear a mask for those 2 days before we kind of came to a team consensus about, yeah, we're going to help the public. And I should say, when we're not helping people, I've told staff they can wear it or not wear it. It's whatever they're comfortable with. So if they decided not to wear it right now, unless they were helping a patron, that's totally within their choice, and I'm fine with that. Does that answer your
Let's
question?
say they are helping a patron,
Yeah.
they don't want to wear a mask, they have the individual right, in my opinion, not to wear a mask. What action do you take?
Well, that could be true, but, technically, we're still their employer, and we still set the boundaries for that,
Right,
environment.
and the town is not mandating masks anymore.
Right,
But
that's
what
fair.
you're telling me the library is though.
I'm asking staff when they're helping patrons to wear a mask, yeah.
So it just seems a little contradictory.
Adam, and I will say this, and this is, it's funny, we've had 2 meetings. Ginny is the liaison to the library as of January. We've had 2 meetings, January and February. And Adam and Ginny and I, and actually Amy probably, the library board, we've been discussing a lot. John, you know from being the liaison of the library, I don't want to call it confusing, but you answer to, in a lot of ways, the state education department.
Yes, state library.
So, and I appreciated what you said at yesterday's meeting, is that you're trying your best to defer to what the municipality's decision is.
That's right.
And I really do appreciate that, so, we'll go for it. But I appreciate the rock and a hard place in a lot of ways, Sharon, because the school, for better or for worse, whether we agree with it or not, is still under the mask policy, but they've been somewhat wishy-washy or whatever on what they say to the library, so, anyway. Chris? Rec Center's a little bit of a different venue than the library.
A little bit. So I did pull some numbers from January up until to now, just in regards to kind of see what our daily visits look like, so we could kind of track. And as an example, in January, obviously the mask mandate was in place. We had an average of 140 what I'll call swipes per day. So people that actually swiped their fitness card or swiped a program card. That doesn't count the people that came in for senior lunch or those kind of programs, or even a Sunday basketball league. That doesn't count that. Those are people that were going into the fitness center or had a program card because they were in a fitness class. So we had 140 average swipes per day. Starting in February, so again, roughly around the time that the mask mandate was lifted, that number went up to 172. So we picked up around, we're going about 30, 32 more swipes per day, basically the month of February. Attributed basically to the fact that now people can come in, work out, don't need to take their fitness class wearing a mask. And we're seeing that throughout the building. Adam, 60-40, I'm probably reversed. I'm probably 40% are wearing a mask, 60% are not. Those 40% that are wearing a mask typically are our seniors, or there are real little ones that are in programs. People that are coming in for fitness programs or in the fitness center, it's the high majority of those people are no longer wearing a mask.
And then, and actually Dolly, but we also have Josh, other people that are department heads out of town hall, but I know with, after February 10th, it's kind of funny to Governor Johnson, because your busiest time is February 10th prior with taxes.
Right.
But since,
Yeah, I mean, I wasn't aware that I was going to have to speak. So
sorry about that.
I don't have any numbers to throw out at you. I mean, we have been busy since February 10th, obviously not at that same level. I'm not always at the counter, so I don't always see the traffic that's coming in. But I have seen very few people wearing masks. I haven't heard any negative comments from the residents about mask wearing. That's all I really have to share.
And thank you, and I should have known, it's 5:42, so we're 12 minutes in, so I don't, here's how I'd like to sum this up. And Charlie, you walked in a little bit late. It's really, we either can do something non-pro-tunc on Monday or next Thursday to basically go back to February 10th, because what we're doing right now is our own policy. This is not the health department's, this is not the state. We thought we were just going back to what the health department and state said. Well, they have, there is no anything. So we either can do that, or, and I don't think there's any resolution in this. I know where you stand on this, John. I can pretty much guess you'd say, take the signs down tomorrow. Now that we've caught the air, just take the signs down. I will tell you this. I would say, after looking at all this stuff, I would advocate for taking the signs down. I also want to figure out how we go about creating a culture where we respect people. Respect them if they want to wear the mask, respect them if they don't want to wear the mask. And I'm not quite sure, maybe there is a marketing PR with another sign that says something like that, but we'll talk about that later. Bill, how do you feel?
I don't think we need masks.
Well, then am I interpreting that you think we aren't doing our own town
Yeah.
law? So we're, take the signs down, we caught the error, take it down. I don't think we need to do a resolution on something. Jenny?
I feel everyone has the right to do what best for themselves. So, you know, whatever it's, like if Adam feel like he wears a mask to protect his future, you know.
Adam has a reason to wear it.
Yeah, so
More
it's
than
okay.
us.
I mean, if anyway, and if people have the underlying, you know, whatever personal, and they feel like they wanted to wear a mask, then shall be it. I mean, I know we try to set the law, but the individual have the right to, you know, apply for it, as long as it doesn't hurt somebody else. That's what laws are for.
Thank you. Patty? Has this train left the station?
The train has left the station because I'm one who actually thinks that masking is a responsibility to each other to keep us healthy. I do still wear one, but I also understand that we are a governmental agency and we really can't fly in the face of what is being unmandated across the state, if you will. We had to follow it while it was mandated, and now that it isn't, I think that we probably can't enforce it. I wish we could put up a sign that says, you know, masks are optional, respect each other, and make everybody feel better about that, but as we discussed today, that's not going to change people's feelings. So, you know, I will continue to wear a mask in public when I feel it's necessary, and I understand that there's strong feelings on the other side as well. I guess I wouldn't be for a resolution that we adopt our own policy.
And that's
It's really the
I think
bottom
that
line. Yeah.
can't be lost in this. You know what? We're going to be right on schedule for the 550, which was directed Katrina, just in reverse order. I'm going to sum it up by saying this. There may be an opportunity to do some signs. We've got some creative people here who've done nice signs on the doors and whatever for what you exactly said. Okay? It's not going to solve the problem of the world. But the one thing that I've found during this is that I don't want people not wearing masks to feel like they're pariahs, scarlet letter. And I don't want people that are wearing masks to feel the same way that they're pariahs or scarlet letter. And I'm going to tell you this. Well, something that turned the tide on this for me, since Brayton brought it up, was I was in the coffee room, you know, and one of our employees, nameless, I went in town hall. I said, hey, you know, I like your mask. I take it you wear the mask because it's fancy. I was just making small talk. And this employee said, no, my fellow employees know that I'm not vaccinated, and I won't get into the reason why I'm not. But because I'm not vaccinated, the rules as of February 10th is if you're not vaccinated, you got to wear a mask. So she's wearing a mask, and she used, and I said she, and she said, so I've got that scarlet letter. And that really resonated with me. For any literary people, I don't want anybody in this town, employee or visitor, to feel scarlet letter. And to me, you want to wear the mask, and Adam, I know why you're wearing the mask, and that's not something I'm going to tell everybody else. That's your personal reasons. Thank you for confiding them in us at the meeting yesterday. But you shouldn't have to explain why you're wearing the mask. And really, Chris, you're not wearing the mask? You shouldn't have to explain. So maybe there is an opportunity for some signage that says, this is how we feel the culture of this town. You do you, and we'll respect you either way. So, but one thing I think I heard loud and clear here is that we caught the error, and the town is not interested in, for the first time in 2 years since COVID started, going off cue of the state and the health department and doing our own local law. That's what it would be. essentially,
So the
right?
law would be just a practice or
Right.
policy.
So I will communicate with the department heads, if the board is okay with that, that the signs are coming down, we'll explain why, and we'll go from there. So, thank you. And it is 5:49, it went longer than 10 minutes. But based on our agenda, the next item up at 5:50 PM is going to be the presentation by Rick Neely. And get that right sooner or later, Rick, you know? And boy, I hope I say this correctly, Katrina Korfmacher? Hey! I was going to say Baker, professor of environmental medicine at the University of Rochester Medical Center on the importance of sampling wastewater and the value of increased sampling. So I'm going to hand the baton to Katrina and Rick.
Thank you, and good evening, and the introductions have already been done, so you know who I am. And I think I spoke at the end of one of the workshops or board meetings in regards to our facility being accepted into the New York State Wastewater Surveillance System, or network. And Syracuse University picked up the cost of the sampling for us to do this once a week. It kind of brought me into this. I was then introduced to the Monroe County Wastewater Working Group, Surveillance Working Group. That's why I met Katrina. She kind of is the MC of the bi-weekly call, and they've been doing this a lot longer than I have. I jumped in. We've been sampling for a month now, once a week, but as we know, to get a clearer picture, we're looking at doing sampling 2 or 3 times a week to kind of get a little clearer picture of what's going on in the community with COVID. So to do that and to dig deeper into this, I invited Katrina to join me to kind of give you a better overview of what's going on, proverbial expert in the field, and looking for actually the support of the board to garner that additional funding to cover the other 2 samples over this next 7-month period. And with that in mind, I'll turn it over to Katrina.
Well, thank you so much for having me, and now I feel like I do need to explain, even though you said I don't. I work at the University of Rochester Medical School, and I'm at work, and this is our practice at my work site. I also teach there. I teach environmental health policy and a couple other classes. And when the pandemic started, I'm not a doctor, so I couldn't see patients directly. I'm not at the public health department, but I realized that I had the ability to try to do something to help with counter the pandemic, and it was this, trying to figure out how we could use wastewater to inform decisions to protect people in the most efficient and effective way possible. So if you were thinking about the choice of whether to pay for this or not, I figured you'd probably want to know why and what it is. And I've learned a lot about it. I'm not an expert, but I certainly have been following what other communities are doing. I'm just really delighted to share it with you and your interest. So I thought I would just very briefly explain to you what wastewater surveillance is, how I think it can help Webster, sort of how it fits into where you are right now, and then also the future potential, because hopefully we are at the tail end of this one, but there's a lot of excitement about what this could do for us in the future, because in this pandemic, and this is a little graphic from a New York Times article back in the fall of 2020, the failure to control the pandemic has in many ways been a failure of real-time health data. That it's been very difficult for us to really, next slide please, understand what's going on. So I wanted to start by explaining that wastewater surveillance, we've seen it in the news recently, but it is a very well-established practice. Back in the 70s, Nancy Kahn, who was one of the first female microbiologists in Edinburgh, found the source of and eliminated a typhoid epidemic in her city by doing this. Next slide please. And it's most famous for helping to stop polio. So the efforts to end polio are really attributed to being able to track the virus in wastewater, monitor its long-term elimination. Next slide, please. So when COVID came along, not surprisingly, people who do this stuff said, well, I wonder if it'll work for coronavirus. So are we able to see this virus in wastewater? Turns out, yes, you could. Very smart people in the Netherlands were some leaders there. Next slide, please. And the logic is this. When we're trying to figure out which direction is the pandemic heading, who's getting sick where, what's going to happen next, we're used to testing people. but you don't get people tested unless they're feeling sick for the most part. And that comes many days after they've been infected and have been infecting other people. Or you can track hospitalizations, right? We've seen all of that data. That usually is a couple weeks after someone has gotten sick. They get sick enough to go to the hospital, and that deaths even after that. So the question is whether wastewater could let us find out sooner what the direction of the pandemic is going on. And it turns out it can. And very reliably, they found an early warning, especially when population testing is super high level, of 5 to 7 days. So the red line is the trend in the wastewater, and the black line is the line in the sewage, and you can see they track pretty solidly. So once that discovery was made, poof, science happened. There have been many, many articles written. Labs all over the country, all over the world, have been working on methods to make sure they can do this reliably, to figure out, how many people in a town of this size would need to be sick to be able to be detected in the wastewater. And it's been quite well established. If you go to the next slide, this is one of my favorite things to check. It's the Deer Island Wastewater Treatment Plant in Boston. And if you know anybody who lives there, you'll know that their pandemic numbers have surged a little bit before ours. So on January 14th, when I saw that high spike had plummeted down, all of a sudden I had hope that we were going to soon thereafter see our cases come down as well, because they have been so reliably tracking, and it's been so robust in predicting what happens in the population. So it's impossible to talk about this subject without making a couple puns. This is Scoop on Poop. That's one of my favorite children's books. So when people are, when we are relying on testing people, the nose swabs, that is limited by who chooses to go test and when. The availability test, the cost of the test, the inconvenience, the annoyance. But everyone contributes a biological sample to the sewer system, to Rick's folks every day. And infected people may start showing in that sample 5 to 7 days before they ever get sick and go to get tested. It's important to know the virus itself doesn't survive very long in the wastewater, but the little bits of RNA remain and can be detected long afterwards. So we can monitor wastewater as it's coming out of this building, as it's coming out of a community like a campus, or out of a whole town at the wastewater treatment plant. And the amount of the genetic material of that virus that we see in a sample reflects the number of people in that sewage set who are sick at that point of time. And the results can therefore inform people in making decisions like the conversation that you just had. So people are often curious, how does this actually work? Sounds really icky, but it's really quite a sanitary process. And I know Rick has got several of these composite samplers. They're just lowered into or attached to a line. And then the sample like that is taken out of it, sent off to a lab where it's spun around in a centrifuge to condense the viral DNA at the bottom, and then it's run through a PCR, and they can tell how many copies of the RNA representing that sample there were. And that sample can initially be taken, it's been taken at universities, at industries, work sites, nursing homes, prisons, wastewater treatment plants like you're talking about today, and across the state, and I think now 40 counties are participating, or 40 sites, 26 counties. So we have a dashboard that's live, and you can check anytime about what the trends are in different places in New York, and there's also a national wastewater surveillance system that's being built. So just to give you a sense of what's been happening here in Monroe County, that is our big wastewater treatment plant in Durant Park, the Frank E. Van Laer wastewater treatment plant, aerial view. And this map shows its sewer shed, where the waste comes from that ends up at that treatment plant. And I wanted to show you this with the different colors because you can see that it's broken down into different sections, like a watershed might be. And your sewer shed is the same. That there is the opportunity to take samples at different places, so you could see if, is it over by where we have our university that the levels are higher, or are they more downtown, or are they up to the east? You could do that, but so far we've just been testing the influence samples to that plant. Okay, and just so you know, that particular plant, as you may know, also gets stormwater into it, so there is wastewater coming out of houses and buildings and work sites. But there is also stormwater that gets mixed up with that on the way to the wastewater treatment plant. So when that is mixed up, they both are ending up at the wastewater treatment plant, which means that it's a little tricky to detect the virus there. But nonetheless, it has still done a really good job of tracking with cases in our county over the last couple years. Next one. I also, you probably saw in the news, in the article that Rick provided you, several colleges in our area have been doing this because they saw what a challenge it was going to be to maintain a safe environment early in the pandemic, especially when they didn't have testing capacity. So we learned together about where they can sample, how they can sample, and what it means for their campus environment. So St. John Fisher has these little boxes, you may have seen them on their campus, sitting next to 6 manholes that basically represent each of them a major dorm. One of them goes hot, they know to test the kids in that dorm. When they all went hot, that's when they decided to close the campus down. RIT has a system that is less visible because they drop that composite sample down into a manhole and they pull it out, which is when you're doing it at 5:30 in the morning on an icy day, not such a fun job, but less disruptive to the aesthetic environment. So these colleges have found over this period of time that in addition to the student testing, and especially when testing rates have varied, this has been an additional source of data that has been very helpful to them in making all kinds of decisions about how they communicate about and how they protect public health on campus. Next slide, please. I also just wanted to give you a really quick example that Corning Industries was so excited about this that they paid all 7 wastewater treatment plants in their area where their employees live to sampling there. And they have taken that data and used it to decide their protections for their workers. They've been doing this since fall 2020, quite quietly, but just using that information, go ahead if you like, so they don't have to be testing the employees as frequently, to get an earlier warning. And they have found that quite consistently, this information has given them a 5-day lead time before people start showing up really sick to work. So it's been very helpful to them in protecting their workforce and keeping their plants open. Next one, please. Okay, so this is where we are now. As I mentioned, New York State has built a wastewater surveillance network. Hopefully you will all go and click on this website afterwards and you can look up your own data. It says that your rates have gone down 3%, I think, in the last 2 weeks. Now, that's just one sample per week, and what we found is that this is really bumpy data. It is much more nuanced, it is much more effective, it is much more useful if you have it 2 or 3 times a week. The universities have found that absolutely as well, because you need 2 or 3 samples to get a trend, to figure out which direction it's going. So we're really lucky that the state has been paying for one plant in each county, and because we pushed really hard to get our other 2 plants into the CDC's national system, that meant that Webster is benefiting from that funding from the state. And you know, your data is up there on the dashboard, and nobody else's in Monroe counties is because the CDC doesn't have its act together quite as quickly. I think that's all I wanted to say on that. Real quickly, if I'm thinking about, if I were sitting in your shoes and saying, okay, the pandemic's going away, why still do this? Testing is much lower now, and people are testing at home. So the case data that we're getting from the county is county-wide, and it is a lot less reliable. So looking forward, being able to get Webster-specific data and confirm that ongoing decline, I think, could be helpful. It's also, you had talked about, people making their own decisions. The original vision of this was to have a dashboard. Like if you go to the beach in the summer and you check to see if the water quality is good or bad that day before you decide to go in. You can check the wastewater and see how safe is it out there. Is this a time that I'm choosing to wear a mask or not? Is this when I'm going to go visit my grandparent in a nursing home or not? So it can inform individuals' daily decisions, nursing homes, residential facilities, businesses, as they decide about how to conduct their business. Also could provide early warning of new surges. If nobody is out there getting tested, how are you going to know if the virus is back in the community? This lets you know. And especially providing a baseline for longer-term monitoring as we come into next year. I also wanted to mention that there is some other possibilities. Rick mentioned he's got a couple portable samplers, so if there were areas of concern where maybe there were a lot of older people or a school shed where there were particular concerns, you could take those samplers and identify where there are hot spots or not, where is a place that seems to be quite free of the virus at any given time. It also, just on a really geeky wonky note, they found the new strains of the virus in wastewater first. In fact, they found in California and Oregon and Massachusetts before they found Omicron in people. They found it in the wastewater. Can monitor the effectiveness of policies about whether vaccines are being effective or not, and whether things like masking or social distancing are helping. And also, there is ongoing work for detecting influenza, future viruses we don't know about, can also be used for things like opioids or cannabis. There's several communities that are very excited about using it for those things. But I think about particularly influenza. We know that we had 16,000 people a year dying of flu before this pandemic. If we were able to monitor nursing homes and in communities to see when that virus is coming up in future years, that has a huge potential as well, even if we never have another coronavirus. Anyway, so those are some of the things I wanted to share with you about this that I hope inform your decision. That's all I have, but I would love to take any questions you have.
Katrina, I want to thank you for presenting. We've known each other for 10 years, and I've known you as an expert in the environmental health field, as well as an advocate, and I really appreciate your work on all of this.
Thank you.
I chuckled when you said the CDC because I had been doing some reading and realized that the CDC is way behind on the reporting. I did find the dashboard for Montgomery County, so I was looking at that.
One of those, things where sometimes starting at the local level is more effective.
It still gets reported to CDC, correct?
That was amazing, by the way.
Thank you.
You're good at your craft. Rick had kind of explained this to me, not in that kind of detail.
No, that's why she's here.
I found it fascinating that, for better or for worse, the town of Webster has its own sewage treatment plant. And if we're going to have it, I'd like to see the town take full advantage of that. And what amazed me is that the one slide, a couple of the slides really resonated with me. The one where you said, here are the things that we track, and they're all kind of after the fact. They lag by days, weeks, whatever. This gives you the opportunity to have real-time or predictive, which is amazing. It makes my mind sore thinking of how you can utilize that for good, bad, whatever. I know at the beginning you had said, Rick, that part of the reason we're doing this presentation, maybe the biggest one, is that will the board approve funding for the next 7 months of this? And off the top of my head, I don't know what that entails as far as if it's a $10 or $10 million for this. Okay, well, that's good. And from a standpoint of, would the testing for the next 7 months be specific to COVID-related variants, or is this something where you could pick up based on testing 150 different things? You could find out, like you said, if from a certain area there's opiate use there, or there's something else coming up in the community.
The lab will test your sample for whatever you pay them to. So I think the cost estimates that Rick have developed is, we've been working this system up for coronavirus. We have the potential for using it in other things in the future. But for example, the Deputy Health Director of Genesee and Orleans counties is very concerned about opioid use in those rural counties. And they just did a pilot over 8 weeks with a different lab. And as I said, they found some very, very interesting findings, and they're going to think about building that into their systems in the future. But for now, we're really focused on coronavirus and making sure, seeing how your numbers reflect your community.
And you said we're on the dashboard now.
Yeah, that was a real screenshot that I took last night.
Yeah, that screenshot, so the brown, is that just a misnomer that those areas are going up by 75%?
The brown just means that those areas aren't testing.
Aren't testing,
So
okay,
they
because I
just-
looked at the key and it said up in the right-hand corner, like.
Oh, that's a dark
Yeah, I
red.
think-
Okay.
Yeah, the brown just means we have no data.
I got you, okay, well,
Sorry about this.
that's okay. So we're testing now, is that because we were chosen, Rick, or?
Yes,
But that'll end and now we haven't been paying for that?
we have not been paid for it. It's been funded by the state.
How long will it be funded?
7 months
So we're
of
looking,
1 sample per week.
so we're looking at doing additional samples to get a better,
Yes.
a better.
And I think the
baseline.
vision is to really ramp up, and you can actually start backing off. Once you get pretty much a baseline of what's going on, you can back off to the 1 or 2 times a week And then all of a sudden, if you see something, then you ramp sampling back up. So
What's an example of seeing something?
I'm still learning all this. I actually got a tutorial on what my results are telling me, and it's a little Greek still.
So
If you want to
you know
back
the
up to
Boston-
the slide from Boston, that could give you an example of that. So they had,
What was that?
if we go back to one of the
Deer
first,
Island.
well, that's one from, the fall of 2020, where we saw that there was an increase for that winter surge there. But if you go all the way back to the Deer Island plant, this is one of their calculations for part of when they closed schools or not. They had just a formula in Boston, in Massachusetts, by their state health department. What percentage of kids were testing, the population was testing positive, and what direction the wastewater was heading. And they said, they just had a little algorithm of what combination of those things would make them decide to have different policies about their schools. And as you can see, they sort of, overcame a couple blips. This big tall one is what happened in January with Omicron.
We're only testing in one location, correct?
Yeah, the influence, just like that. We've got 2 portable samplers that if we did see something, we wanted to try to locate areas, we can go out and do it. And what's great about it is you get a 24-hour turnaround time. If it gets shipped, and we get sampled the next day.
Well, our point is, we're only testing in one location now. We could have other areas in the town where we have problems. You're not gonna know that because it's all going to our treatment.
Right, well, that's, if we saw it, then we will be sampling at the plant till we have a sampler, then we have 2 portables, we can go out and kind of isolate areas. And the sewer shed is what we was talking about. We can drop a sampler in there, and there also test that our influence, we kind of see the correlation between where the results are coming from.
You haven't done that yet.
No,
Our friends in Madison County had 7 of these going for a similarly sized community, and they found it so useful, they just ordered 7 more. So starting with one plant to see, let's get a picture, a snapshot of the whole population. And you've got, I think, 34,000 of your 43,000 people or something are served by this plant. Obviously, if you have a septic system, you're not involved, represented.
So what type of adjustments, based on the reading, would a community make?
Different people have done different things, as I said, usually in combination with the case rate data that they're getting. And
Okay,
that's
but
what they get.
a case rate doesn't necessarily correlate to someone being sick or someone being hospitalized, which is what originally in the pandemic was being tracked. They were tracking, how many people tested positive, and how many people were hospitalized and how many people had passed away with corona or because of corona, okay? But then I think it was at some point last year, all of a sudden, the hospitalization rate and the death rate started to go down, and then we started tracking positive cases, okay? And I'm just trying to understand what we would do with these results as a community.
Well, the best examples I can give are from the colleges and what they've done. So, for example, when they have very low testing rates, or they weren't regularly testing, they didn't have enough money to test all of the students at once. Actually, no, better example is from Madison County. The director there said this is a pretty small city, pretty small town. We don't have a lot of testing capacity. But when we see that wastewater number going up, we're going to get the state in to come and help us provide that testing capacity.
Yeah, because I know that there's quite a large number of colleges that mandated the vaccine and the booster for a demographic that has a 99.97% survivability rate. They're making them mandate getting an experimental vaccine, and I'm confused about that.
John, on this, I think the key point you want to take out of this is it's an earlier indication of what's going on. You can jump into this and you can ramp up masking and social distancing earlier, which lessens the severity of the spread. Because by the time the state or the communities are learning about it, it's already around. This way it catches it a lot earlier. It's really just early warning.
What's the cost of testing?
It's $250 every sample.
So what would it be over the 7 months, Rick, that we want to
Looking
test?
at, if we're doing it 2 times a week, additionally, it'd be about $15,000 over the 7 months.
And then, if you do have to do the quarterly ones, is that still 250
Well,
also?
again, like I said, that would give us the buffer, but also we would ramp up in the beginning, and then we can start backing off, and you would have that access to sample externally.
When does our current 7 months that is free right now end?
July or August. We just started in February.
Okay, well, that's good to know, so it's, I mean, we can do a little more time to figure out if we want to keep going into July. And and I'm admitting, this intrigues me, especially because, he's not here to defend himself. I said Ray Connor, our human resources director. He said to me last week, or whatever, that, you know, wait till you see what happens in Halloween 2022. He was saying things we might have another spike in something. Come on, really? Are we about to peter out of this thing, the Omicron and whatever? So if that 7 months, if we decide to pay for it, it would cross that path of July to January of 23, July, and we would hit that time frame in the Northeast that we've seen in 20 and 21 where it spiked, that November and December. Right?
Well, I think the ask was to start sooner so we can get a better baseline now, but
So we're on a free ride,
we're only doing once a week.
one sample through July.
Poor Rick showed up at his first meeting, and the group that has been doing sampling in Monroe County for 2 years said, it's great that you're here, it's wonderful that the state has brought you into their system. It's unfortunate that it's only 1 time a week, because our experience has been that you need 2 or 3 times a week to be able to get a trend where you can make meaningful decisions in real time. So what Rick's asking is to be able to increase the frequency now, so that you can learn and see this sample in the signal in real time. I should also annotate that the current governor has expressed very strong interest in this as a non-invasive way of tracking the pandemic in the future, and signaled that continuing to support this in the future is likely priority. Of course, one never knows until the budget for the next year comes out. Right now, ARPA funds, towns are able to use CDC funding, or at least health departments are able to use those funds for this kind of sampling if they wish. So I can't promise what's going to happen after 7 months, but the signals have all been that this is not going away.
I only have one last question, because you showed in here like the Alexandria, Virginia, and Eastern Franklin. Are Pure Waters is on this right now? Is testing?
Monroe County?
Yeah.
That's Denmark.
They're testing, yes.
Right. And that Alexandria, Virginia, you showed how that's you got stormwater going in, and ours, we avoid I&I, is purely sanitary. Does that make it easier to sample?
Yeah. I just showed you that because Alexandria has a nicer graphic explaining that they have a combined sewer overflow flow, and that combined sewers, and that nonetheless, the data coming from Van Leer is pretty good. Yours should be much better because you don't have that variability with the rainwater getting in all the time. They've been able to correct for that, but it's just you have a nice size system compared to Van Leer.
Very interesting, and we'll continue to talk about this because, like I said, I'm intrigued from the standpoint of we're going to get beyond COVID. But if this is something, especially with what we're trying to do with our sewer plant, that could be of value to the community for the next 20 years of predicting certain things, that's the part I can't figure out. How do you use it? You know what I mean? But that's another day's discussion.
Well, I would be happy to have that conversation about what other communities have done some other time, because clearly
Sure.
this is something I love talking about for a long time, but you haven't only done it today. So
Katrina,
thank
thank
you so
you
much
very
for
much.
inviting
This
me
is-
and letting me share what we've been doing.
Thank you for doing a remote class.
My pleasure. Take care, everyone.
Thank you, Katrina.
Thank you.
So Josh and Nick and Kyle and everybody here for that presentation that was originally scheduled for 5:30, I really appreciate you being patient. And hopefully you enjoyed the first two agenda items. And I'm very happy to see that Mr. Hauser and Ms. Volo are here from the Zoning Board of Appeals. I had invited them because once this presentation is done, some of the questions the board may have may be best answered by Don and/or Kareem, from being on the Zoning Board of Appeals, from being in the trenches of some of this. And Don, you really being in the trenches. Oh, God, well, dug the trench. I dug it. So, our next item is a presentation by Josh Artuso on possible code changes.
Thank you, Supervisor. So the focus of tonight's presentation is primarily on the shed and fence regulations that we currently have here in Webster. So I'll just begin with letting everyone know what the current regulations are. Section 225-48 covers utility sheds. So the code states that essentially all utility sheds shall be permitted in a side yard or a rear yard in any residential district no closer to any boundary line than 15 feet. So that's 15 feet off the rear property line and 15 feet off of the side. For fences, it's commensurate with the height of the fence. So 4-foot fences are allowed right on the property line currently. 5-foot tall fences need to be 5 feet from the property line. And the most common fencing style, 6-foot privacy fences, are required to be 10 feet off each property line, both side and rear. So we did a little digging historical background information, utilizing former copies of zoning codes dating back all the way to the late 1930s. So from the research we were able to do, the shed regulation first came into the code around 1938. Actually at that time, there was only a 5-foot setback requirement, and it was later changed to 15 feet sometime in the 1970s. But when initially implemented, the 1940 population, the town of Webster had approximately 5,500 people at the time. What we did was we calculated population density, which is simply taking the number of people and number of residents you have, dividing it by the square mile area of the town. So at that time, there was approximately 164 people per square mile. Moving over in regards to the fence regulations, the first that appeared was in the early 1950s. So the 1950 population of Webster was a little over 7,000 people, still a relatively low population density of about 213 people per square mile. So as I mentioned, that was implemented in the 1950s, and they remain the same as they were back then. So then you take a look at the current, most recent census data from 2020, and the town of Webster's population is roughly 45,327 people. And when you calculate the population density, you can see that it's increased quite a bit since these current regulations were initially implemented. So we're right about 1,350 people per square mile at this point in time. So the next slide is a graphic that illustrates, we wanted to benchmark what other municipalities in Monroe County are doing in regards to fences and sheds. So with the assistance of our building staff, we compiled regulations from all of the towns in Monroe County. And as you can see on the map, Webster is only one of 4 towns that has the setback requirement for a 6-foot privacy fence. All the towns shown in green permit 6-foot privacy fences right up to the lot line. The only towns that don't are indicated in yellow there: Parma, Ogden, Wheatland, and Webster. So the table on the right side just shows you the population, the square miles of each of those towns, and then the relative population density. You can actually take the population of those other 3 towns and add them up all together, and they still do not equal the population level here that we have in Webster currently. The next map shows shed regulations. So like what we did with fences, we compiled all of the town's different setback requirements pertaining to sheds. And this was a little bit varied comparing to fence regulations. But the darkest green color essentially allows a 5-foot setback from either the side or rear property line. The lime green-ish colored towns, their setbacks for sheds ranged anywhere between 6 and 10 feet off the property lines. And then the yellow towns had anywhere from 11 feet to 20-foot setback requirements. And again, the other towns in our category are Ogden, Rush, and Mendon, significantly less population density. So what we did was we compiled some historical data, the last 10 years worth of variance applications for both sheds and fences over time. There really isn't a strong pattern to glean off of this. I would have liked to have gone further back, but due to data keeping and the town switching permitting softwares over time, it would have required a really intensive manual effort to go further back prior to 2012. So what we have here is basically showing 10 years worth of data. It seems to ebb and flow. I'm not exactly sure what causes those trends, but just at a glance, some years we have more shed variance applications, and other years we have more fence variance applications. So just a brief recap of the numbers of that 10-year period. So basically from 2012 to 2021, we received a total of 175 applications for variances pertaining to sheds and fences, 104 of them being for sheds, which is on average about 10 cases per year, 71 variance requests for fences, and those are about 7 per year on average, give or take. So out of those 175 applications, approximately 66% of them, or 116 of them, just required attendance by the applicant at one meeting. 29 of those applications required 2 meetings. 7 applications required 3 meetings. There was 1 application that required a total of 4 meetings. There were 2 applications that actually required attendance at 5 meetings. And then 20 of those applications were either denied or withdrawn by the applicant altogether. So here are some unintended consequences of current shed and fence setback regulations. This is a combination of feedback we hear from residents that we deal with at the permit counter, and just some other observations that staff have made. It really limits residents' ability to fully utilize their backyard. 10 feet is a pretty significant strip if you want to enclose your yard. Many families and residents in Webster have young children. They also have dogs, and 4-foot fences generally do not contain dogs or serve to create privacy. You know, if everyone were to erect a fence off, you know, according to the setbacks, you end up with these 20-foot wide, in some cases, unkept alleys between these neighboring fences. Sometimes neither neighbor wants to be bothered with maintaining, mowing the lawn outside of their fence. It actually creates quite a bit of boundary line disputes. So in an instance where you have one neighbor that erects a 6-foot fence 10 feet off the property line and chooses not to maintain their lawn outside of that area, most often the neighboring property that looks at that will take it upon themselves to mow it, or they will call the town code enforcement to have the town urge the property owner to mow it. Now in some cases, in those that actually choose to maintain it themselves, it's created boundary line disputes when people go to sell their property. For those of you that aren't familiar with the term adverse possession, if you are utilizing land and maintaining it after a certain period of time, you actually have legal rights to that piece of property. So another drawback is that for a somewhat common thing that a lot of residents need and want, you know, both sheds and fences, it requires them to go through a pretty robust approval process, often requiring attendance at several meetings before the zoning board. I personally believe it's aesthetically unattractive, but that is my own personal opinion. Some residents, when we articulate what the regulations are at the permit counter, you can just tell their reaction, and they basically indicate that they're not interested in it anymore. But then we find that they go ahead and erect a fence or place a shed anyway. So they're not permitted, obviously. So that leads to enforcement efforts, which are very time consuming. You know, I think you could drive through just about any neighborhood in the town of Webster and identify many sheds and fences that are clearly not complying with our current regulations. So this next slide provides some photo examples of what I just described. You end up with fences that don't quite meet, with gaps in between them, unkept vegetation, sheds that traditionally are in most places tucked in the corner of the lot are brought much further into the backyard, limiting, again, what people can do in terms of adding decks, patios, swimming pools. I know that when the pandemic started, our building department was flooded with in-ground pool permit requests. I mean, there's pretty much a 2 to 3 year waiting list right now, and a lot of people have decided that, you know, after this pandemic, they, you know, appreciate being outdoors, they appreciate creating spaces on their own property that them and their families can enjoy. So some of the historical justifications for the current shed and fence setbacks, you know, to maintain an open, airy feel for the town. My argument to that would be, you know, Webster has grown quite a bit over the last 60 to 70 years. It is no longer primarily an agricultural town of rolling hills and prairies and farmland. You know, we have a lot of residential development that has occurred over the past few decades. So that would be my response to that. To allow for maintenance of a shed or a fence without going on to a neighboring property. The thought with that is with a 4-foot fence, you can reach over and paint the opposite side from your own property, whereas a 6-foot privacy fence may not be, easily accomplished that way. My response to that is a trend that we've been seeing most people going for are these maintenance-free vinyl fences that don't require maintenance. A lot of these fences, you can swap out panels, replace panels from your home side of the property without the need to go onto your neighbor's property. This is another quote that I've heard several times. We don't want Webster to turn into Southern California with everyone walling off their backyards. I think that most people in this room could agree that towns like Perrington, Pittsburgh, Penfield, our closest neighbor to the south, who already have fence regulations that allow fences right up to the property line. I don't believe anyone equates the character of those towns to Southern California. So I think the fear of everyone just running out and installing and fencing their backyards, I don't think that's a valid concern. And another thing that I've often heard is that so that sheds aren't visible from the street. Even sheds that are 15 feet offset can sometimes be visible from the street. I will say that sheds have come a long way. Most of the sheds that we see coming in through the permit office replicate the house. The homeowners are very conscious about it fitting in. They want the same color siding, they want the same style roofing. A lot of them have decorative windows. So they're not your standard metal utility sheds from previous years. They're more aesthetically pleasing.
Yeah, I haven't seen anyone just driving down the street in the middle of the town slowly just put sheds either, so I would agree.
So our proposed recommendations and next steps, we would like to continue our analysis of other municipal regulations, draft an actual recommendation based on data and best practices for similarly sized municipalities, and then we would look to have the town board hold a public hearing to get resident feedback on any proposed changes. I would like to clarify, this is primarily dealing with 6-foot fences. We're not suggesting necessarily any changes to 8-foot fences or 10-foot fences. I think when you go higher than 6 feet, having it offset from the property line so that it isn't so imposing on the neighbor is appropriate. But 6-foot privacy fence is the most commonly requested type of fence. It does provide the ability to contain animals and children. And, obviously your neighbor, if they're looking out a 2nd-story window, can look down into your backyard. But when you're, having a barbecue or having a pool party and you're outside, 6 foot does, provide a level of privacy from your neighbors. So, we wouldn't be looking to adjust anything. Fences would still not be permitted in the front setbacks. If there are any existing drainage or sewer easements, we would not permit any fences in those easements without license agreements, as we have done in the past. So it's really just trying to reallocate our resources to more impactful things that also need to be addressed, and I'll touch on that in a minute. But it also, I feel, would really improve the customer service experience for our residents. In a lot of these other municipalities, someone can walk into the permit counter, apply for a shuttered fence, and more often than not, they walk out with their permit. With our current situation, as you can see, it sometimes, requires attendance at multiple meetings. And until 6 or 8 months ago, when we switched to the signs, the residents had to mail out to all their neighbors within 100 feet, letters to let everyone know what they're doing, and if things get tabled, you know, it's just not an effective use of their energy, in our opinion. And I'll mention, I have with me here tonight our building inspector, Nick Mooney, and our assistant building inspector, Kyle Rader. I also wanted our code enforcement officer to be able to attend tonight, but unfortunately he's off this week. But we are the front lines of town staff that typically deal with the residents at the first point of contact at the permit counter. So I have our staff here to answer any other questions from their perspective in dealings with residents when these types of issues come up. So there's some other code issues that we would like to start working on as well, which I've listed here. Temporary canopy structures, those carport metal frames with canvas on them. You know, we get a lot of complaints about those. Those can tend to be very unsightly over time. And right now our current code basically says that they can't be used for office or living quarters. You know, it doesn't define where you can place them, how long they can be there, how many you can have. So something like this is a much more problematic thing that we hear complaints from residents on, that we would like to focus our efforts on. Same thing with temporary fences, often used during the winter months to prevent snow drifting. We get a lot of complaints from neighbors when they see an orange temporary fence go up, and our hands are essentially tied because there's nothing in our code that allows us to regulate that in a meaningful way. Telecommunication towers, I believe we had a workshop several months ago on the federal regulations that have recently been adopted and are in major conflict with our local code. You know, emerging technologies that are either recognized or mentioned. You know, homesteading is becoming a larger trend. Our code doesn't deal with really raising of animals or, you know, chickens, eggs, domesticated things of that nature. Hydroponic farming, a very big gray area in our code that we would like to address. Site plan approval processes, making a distinction between a major and a minor project, and potentially changing how those are reviewed and approved. Defining orders of approval. What order is the most appropriate for a project to go through? Does it start with the planning board or the zoning board? We'd like to strengthen some of the definitions that are left open to interpretation and sometimes used against us. And we'd also like to establish a more robust section that covers different non-conforming uses and structures. So I bring these to your attention because the shed and fence regulations do require a lot of administrative paperwork, a lot of inspections to make sure that people are complying. And I don't necessarily believe that that is the most efficient use of our precious resources. You know, most local governments are being asked to do more with less, and we just want to make sure that we're focusing our efforts on the most impactful issues that are facing the town. So with that, I will turn it over to the board, and you know, we'd be happy to answer any questions or hear any comments that anyone may have.
Well, I would like to, first off, thank you for bringing this to the board. I've been waiting for this for quite some time. And I did have a question. Are you aware of what the village's setbacks for sheds are?
Yes, the village of Webster has a 8-foot setback for sheds, and they allow fences right up to the property line.
Right, and a resident of the village can walk into the office, fill out a form, and you're good to go. And I think one of the things that you pointed out is of significance is customer service. And you've elaborated on the fact that there's 1, 2, sometimes 3 or 4 different meetings to put up a shed, because people definitely don't want it in the middle of their backyard. And I would most certainly support a public hearing to change these codes, for sure. And thank you for the presentation. Thank you for the research that you and your team have done. And I think we hold a public hearing, we'll hear from the public, we'll make a decision. And that's where I come down on the side of this. Thank you once again.
John, what's the height permit for fences in the village? 6 foot?
I'm not sure. I know that the square footage that you're allowed for a shed, because I put one, I think it's either 80 or 100
What is it,
square feet or
you know?
something.
Yes, 6 foot.
6 foot. So anything over 6 foot, you need variance, but you can put them on the lot line up to 6 feet.
That's my understanding.
Okay. So there's probably how far you can bring it into the front area, I assume.
Correct. And like I mentioned, we wouldn't be proposing any changes to that portion of the regulation, because we certainly don't want, 6-foot fences in the front yard.
Right.
We're primarily talking about the rear yards.
Right. Okay.
What is the current regulation for how far you can bring a 6 or 4 foot fence from the back down the side yard? How far?
Anything in the front yard has to be 4 foot or less, and it has to be decorative. It cannot be solid, can't be chain link.
Okay.
It's to the front of the house. It has to be even with the front of the house facing the road, correct?
No, if it's less than 4 feet decorative, it can go up the property line.
If it's 4 feet.
Yes.
Or less.
Or less.
And just to add, Penfield, I just double checked the website before we came down here. For a 6-foot fence on the line, you don't even need a permit.
Jenny, do you have any questions or?
So the people who ever had it before, they can grandfather in, right? There's no issue with that, or do they have to, take the fence down if they're shut down because of the new enforcement?
No, Charlie, correct me if I'm wrong. I think that by changing the setbacks, we would actually be bringing a lot of the sheds and fences that aren't currently in compliance into compliance. And then anyone that had received the variance in the past, they received permission to go closer, and I don't believe there'd be any negative implications on that.
I was gonna say, I love it. I love it, but this is the anti-grandfathering thing. What, there'd be no reason.
Well, you're not grandfathering. This is
No, we
making it basically.
loosening the code.
Right.
Yeah.
Right, so.
So how does Penfield know that the fence is not being installed in one of their easements?
Well, they do have a notation on there that special permission is required if you are proposing to put a fence.
You have to go through, if there is an easement and proposing to put a fence in the easement, you have to go to a town board meeting and sign a hold harmless agreement.
Which is
But they have to find the offense in the easement
Yes.
before that occurs. Thank you.
Well, I don't think-
Majority of these multiple meetings for the same applicant, my observation has been, correct me if I'm wrong, is the applicants 90% of the times, they're not prepared.
Well, hang on one second, because I'm just thinking where the cameras are and whatever. 2 things. One, Don, I don't think anybody but in the room can hear you, so you're not on the tape right now.
That's good.
Well, I mean, if you want to go to the podium, but the funny thing is that you gotta love Mr. Housen. I said, I'd love you guys here for being the the panel to answer questions. I should have known. Don's gonna ask questions.
Sorry.
No, I love it, it's good.
The other thing I would suggest in Penfield, and what we see many times, is new homeowners come to us. All of a sudden, it came about because we said something, that there was an easement. They don't even know there's an easement. So if they're not going to town hall in Penfield,
But the
just
permit's
putting
not
a fence
required.
up, they don't even know the easement's
Well,
there.
and that's why we're not proposing to not have a permit
Thank you.
required.
I didn't hear that
Stating
right in
that
the proposal.
Penfield, that's their, I mean, I would never propose that, because then we have no idea if a fence is going up, where it's going up, if it's
Right.
on, if it's 3 feet on the neighbor's property.
And I hope my friend Vicente doesn't take this out of context, but what you're talking about is tantamount to, well, Jimmy jumped off the bridge, why can't I jump off the bridge?
And,
We're not looking to jump off.
and on the other hand is if they're getting bad information or information that they don't like what they're hearing across the counter, and they install it anyhow, it's easier to build it now and ask for forgiveness later. Then it puts us in a bad spot, us being the town. Well, shame on you. My opinion. Thank you.
Well, I heard it, I don't know if we go back to the tape that anybody's gonna hear it then. I still think you should take the podium, you got nice color, you must have been down south, all right? You should-
High blood pressure.
Oh,
You've been talking to my doctor, just had a physical with us.
I don't know how to follow that up. Bill, that was great, Bill. Bill, you have any questions on this?
No, I think there's a need for change in regulations, especially for the areas that are your 281s, the cluster development. They're killers.
And it,
They're absolute killers of the code. They're just easy solution is, okay, that lot is maybe 50% of a normal lot for that original district.
And
Don, I love you, but I can't hear you.
I love you too, honey.
come on, Don, get up on that podium. Green, you should follow.
all right, we'll go together.
All right, for everybody watching at home on tape, you're looking at two of the esteemed members of our zoning board of appeals, Corinne Volo and Don House. I'm Don, that's correct.
I wanted to be Don today.
Okay, go ahead, Don.
The cluster subdivisions are one of the issues that we tend to have. I'm assuming that they did not exist when the codes and the setbacks were established. And you have a house that can be 5 feet from a lot line, and yet the shed still has to be 15 feet. Whether we change the setbacks in their entirety for the additional structures, or if you make these structures match the setback of the house, it's just, the town has evolved where the setbacks is a carte blanche, everything thou shalt be at 10 or 15 or 20 feet. Just, it's no longer logical with the development that is now happening in Webster.
Corinne, can I, before, in the second to last or whatever slide, Josh did a proposal, and I always say, he took a white piece of paper and had it drafted. So he gave the idea of 7.5 shed and whatever, and 6-foot fences on the line. Now that's why we'll have public hearings and talk about this. We're not making any decisions tonight. I've said, I think you and I are saying the same thing, Corinne, is that there might be something specific to zoning, because the smaller the lot, when you get into those cluster lots, some of those lots are 10,000 square feet. There's just nothing there. So do you, where an R2 and R3 is 22,000, 28,000, so is that what you mean by a la carte? Like we almost have to?
Not necessarily making them bigger for bigger lots, but when you have when I've got, and I'll use the cluster subdivision as the example, when you have that, and the houses can be typically either 5 feet from the lot line and 15 feet between dwellings, it makes no sense that the bulk structure can be 5 feet and yet the shed still has to be another 10 feet in. It's just, it's not in
One of his
my
slides
engineering
showed
brain
that,
logical.
actually, right there. It showed a 10,000 cluster.
Yeah, but I mean, the
layout.
clusters over off of Phillips, they're very skinny lots and they're short, so. And maybe that's part of the subdivision approval process?
Well, those were supposed to be patio homes initially.
And now they all have pools and fences and sheds.
Yeah. People wanted the, smaller lot, the large house, which was supposed to be a patio home, and evolved to, normal size homes.
Right.
For that era. And people want to have whatever they could have on a normal size lot.
Don't you call that, Shirley, the 10-pound, whatever?
Yes.
Well, if I'm paying taxes on it, I ought to be able to use all of it, I think is the
Yes.
mentality that we get. And
People don't
we've not,
understand what they're purchasing in relationship to what the regulations are. And it's really not their priority at the time of purchase until they, becomes a priority to install a fence or a shed. And then it becomes an issue.
You know what's funny about that, and I don't want us to go too deep in the weeds on this tonight. And Josh knows we've talked, Josh, obviously Josh has been here 2 years, a little over 2 years, married to whatever. One of the things we have talked about doing is once a property changes type, whether you're buying a new property or you're buying an existing house and not having more, is like a month after they move in, a welcome pack from the town of Webster that somewhat does in a very succinct way, colorful, not a war and peace, just this is what you got. So, because how many people walk in here, I didn't know. And you can sit there and say, and this is a guy coming from the mortgage industry, Charlie, you've been in real estate closings. Well, your attorney, didn't they explain that at the closing? You're going through 500 documents in closing. You're desensitized.
Well, and in most real estate contracts, there's just a blanket clause that says it conforms to the zoning, and if any permits are needed or required, they're given. So that sort of, nobody really looks too closely at that at the time. They don't understand what that is. They're just concerned about the house, getting the money for the house, which is, like you say, most of the paperwork is involved in the loan.
And it's funny, because, and I'm glad that Don and Karina are here today, because I can't stress this enough. We're not trying to make the zoning board of appeals not, obsolete. And that, by no means, because you will still have a lot of things coming across your desk. And that's why when you said your proposal doesn't get into the 8-foot fences and whatever, because they'll be heard by the zoning board of appeals if they want to be, closer or not as far off the line. But it just seems as though from this data, at 10 years of data, you have 24 meetings a year, maybe not even, because some of these zoning board of appeals meetings are canceled for whatever reasons. And to think that you have about 18 of these a year between shed and fence over the last 10 years, you're talking almost one a meeting. And I know that, I've watched some of your meetings and this and that, and those meetings go sometimes till 9:30. Once again, the inefficient use.
It's not like the 3 o'clockers years ago, right?
They're
Well,
4:30 in the morning.
But I just want to say what Josh said about, resources and we're trying to do more with less and trying to be efficient from the 3 gentlemen at that panel. That's also, we're trying to be more efficient for the 5 people that are on the zoning board of appeals.
well, and I think you'd have less people, now maybe no one does this really, just putting it up anyway, and if I get caught, I get caught. And then I'll come to the zoning board and I'll get a variance because I put it where I wanted it. If the setbacks are more reasonable, based on the evolution of the town, I'd like to believe we would get less ignoring of what you're supposed to apply for.
No.
Maybe not, I don't know.
No, if they want to ignore it, they're going to ignore it.
No, you're absolutely.
But looking at some of these suggestions, 7.5 feet, other than the fence being permitted on the property line of having a height of 6 feet, majority of the requests have been 2 feet, 3 feet, 4 feet.
Right, we've had a couple that have gone in on the lot line. Very rarely do we allow it. I love E-code, because I'm retired and I had nothing else to do today, it was cold out. I went through the different municipalities and what they do for fences. And they're much broader in what's allowed and what's not allowed than I would have expected. But a majority of the towns do allow 6 feet on the property line. My only concern as the zoning board person who gets the irate neighbor when you go look at the property is the maintenance on the backside of a 6-foot fence. And maybe we don't care. It doesn't seem to be a problem in Penfield. They're on the lot line in Pittsford, and I don't see a bunch of people up in arms. Menton allows it on the lot line. So maybe, and maybe you get along with your neighbor and he allows you to go paint the fence every couple of years if you need to.
Well, and as Josh said, the fences now with the panels and all that.
And yeah, in front of
So you can just put that, you can just
I
put
would
that
say
in the permit.
95% of the
It's
60
required.
privacy fences are
Charlie.
maintenance.
Charlie.
It's,
I mean, I had.
It's like EF Hutton back there.
I'm coming from my fence, which is on the lot line, that's the old picket thing, you know, I got from Chase Pickett, I think, put it up myself, but the fact is that you required, the zoning board, which I was sitting on at the time, they required that the more decorative side faced the
Right.
neighbor.
Which is where all
It's
my
never been
fiestas
painted,
are.
it's been there for 32 years or 33 years, it's never been painted. But
your
it
neighbor
doesn't
has
have
a
to be.
complaint?
But I think just put it in now just put it in the permit process, that if we'll give you a permit, but the fence has to be.
And 99% of the
Yeah,
vinyl
plastic
fences,
or
they're
whatever.
the same on both
Right,
sides.
right.
And Charlie, correct me if I'm wrong, a lot of what we've been talking about the last few minutes is almost like, take Josh's end of his presentation. Here's what he's suggesting, we do this, go to a public hearing, get, people's thoughts.
Yeah.
We propose something, but that's not the final rule, because we'll hear what people have to say.
Well, you're not talking about a formal public hearing, you're talking about like an informational meeting just to get it in.
Or do you
I
rewrite
Well,
it?
public hearing is
I
it's a
think-
legal term.
I'm talking about the legal, isn't that what you were talking about, Josh, in your presentation?
I see what the point you're making, Charlie, is what are we, the public hearing?
Well, public hearing is where you have a local law proposed and you come in and you hear on a specific law, and you just want to get people's input.
So I'm gonna go back to this slide, it
It's up
says,
to you.
draft revised regulations based on data and best practices, and then hold public hearing.
Oh, okay, so you do want to have a law.
That's, now, we just did this last year with the sign versus the 300 feet away letters. And we posed the drafted change, we held the public hearing, if you remember, there were 4 of them, because that touched 4 different codes, and then we adopted it. I kind of saw this would be the same thing.
Oh, it's
The
fine.
interesting thing being, just if the draft says what Josh has there, 7.5 feet on the setback, and 6 feet on the property line, the public hearing, based on the citizens coming in, and hopefully things that you're saying there, maybe that public hearing says, we tweak off of that draft, based on what we heard. Can
Yeah,
it?
well, sure,
That's
of
the-
course.
That's the purpose of a public hearing. Remember, that comes in and says, this is great. So,
Your water didn't go.
It's gone.
it is
What's gone?
7:01, and that's basically what I was saying, is that I think we're past the Q&A portion, and I was saying the last couple minutes, almost getting into like public hearing type of discussion. Why don't we save that for a moment?
But I just want to, you're not married to these numbers at this point, because you said you want to do some more benchmarking, so it may not be exactly what you outlined here for a public hearing.
Right. Exactly.
So just want to
Good work,
clarify that.
Team, thank you.
Yeah.
So you,
Don, you're next for
you
dinner.
and Corinne and Don and other people are doing sort of a mini advisory panel on what should be done.
Yeah.
I guess I just
Well, and I mean,
I'll
I'll help do whatever legwork you need.
volunteer you, I should say.
I think you did. So, unless there's other, there's a Q&A portion. I think we are officially done on an unofficial meeting, the workshop. Pretty good topics tonight, thank you all, we're done.
Can I talk to you for a minute? Well, it's because you kept asking questions, making your comments.
Go back to the tape.
I don't know, I have to look at my
I wanted to get some Pepsi, man, but up here. $200 for a stone. Oh, yeah. Sorry, all I know is $2. Yeah, right. Yeah. Oh, it's-
No, it's okay.